Vera Davis, and I'm a registered nurse, and as well as I'm a family nurse practitioner student with West Texas A&M University. And today I would like to share with you my poster presentation, Sleep for Your Health. So we know that the majority of individuals have actually experienced at some point in time a lack of sleep, or just as sometimes we call it, a fitful night of sleep, whether that's a newborn infant cared by their parent and the parent had to stay up all night, the child didn't have their days and nights kind of regulated, or going into college students, or any student for that matter, studying for exams late into the night and having to go into the next day on just very few hours of rest. So that is something, lack of sufficient sleep has definitely been experienced by all at some point in time. And so an occasional insufficient amount of sleep may or may not be detrimental, or actually it's not quite detrimental in causing chronic health issues. However, we can definitely attribute different decreased focus to that, lack of inhibition and better judgment, and just not to speak of just an overall feeling of just not feeling well the next day, just being tired. Most of us have felt the effects mentioned previously. However, we must take into account and acknowledge that not achieving proper rest may actually lead to more serious health issues, chronic health issues in fact, such as obesity, heart disease, endocrine diabetes, type 2 diabetes mellitus, as well as play a major role in mental health issues such as depression and anxiety. During this presentation, I would just like to definitely make sure that there's a couple of objectives that you're aware of. And I'd like to increase your awareness of the relationship of proper sleep with optimal health, as well as to improve your ability to judge your sleep and have an understanding of what sufficient quantity and quality of sleep is on your own individual level. I'd like to provide you tools and resources to aid in non-pharmacological ways of improving your quality of sleep. And I definitely would like for you to know how to identify how insufficient sleep quality impacts health, mental acuity, and emotional well-being. During the steps in this presentation or poster presentation, I've used a method in regards to obtaining information regarding sleep health, which included literature review of both evidence-based practice as well as non-evidence-based practice articles. Information was reviewed including both the results by researchers in the form of results tables from studies performed on willing participants, and additionally, the researchers provided their own personal experiences with insufficient sleep that has been used in this presentation. Additionally, the Pittsburgh Sleep Quality Index, also known as the PSQI, has proven to be a relevant tool in measuring participants' actual subjective responses to their sleep quantity as well as their quality. The PSQI does draw upon subjective information provided by the participants in regards to sleep habits and quality of sleep, providing measurements in number form ranging from 0 to 3. Once all the sum total has accumulated, a global score of 5 or more is actually indicative of a poor sleeper. And the results, I have provided that tool for you here as well. And so you may want to take that and just take inventory on how you're sleeping, because I actually did it, and I was thinking that I was a pretty good sleeper. I do try to make sure that I get between 7 to 9 hours of sleep, depending on what's going on in the day. And although I get my sleep hours most of the time, I have learned that my quality of sleep is lacking. So that's something that I'd like to work on. Just to getting to the point, adults really should get between 7 to 9 hours of sleep nightly. So I know that sounds like a lot. A lot of people may feel like they can get along pretty well without that much sleep, and you may not need 9 hours, but what you want to do is take into account on the next day, just kind of take note of how much hours of sleep you've received. And the next morning, kind of ask yourself, oh my goodness, how did I do? Did I have focus? Did I have clarity? Did I need additional caffeine containing beverages or food food to maintain wakefulness. So in order to just kind of use that as a self-inventory to determine how many hours of sleep is best for your optimal health. Evidence has actually shown that individuals that only receive about 6 hours of sleep, and some people 7, if they're kind of teetering on needing more sleep. But 6 hours nightly are prone to chronic health issues, as we mentioned earlier. And I will again, the obesity, the decreased cardiovascular health, type 2 diabetes, as well as psychological disparities such as depression and anxiety. During restorative sleep, the body has an opportunity to heal itself through the building of immunity. So with insufficient sleep, that lessens the body's opportunity to promote self-healing, decreases immunity. Also, the learning is consolidated and memories are consolidated during effective sleep. So when we have a decrease in that, that also declines as well. Memory building and emotional regulation is also formed during good restorative sleep. Regarding cardiovascular health, it has been noted that individuals with hypertension actually have an imbalance in regards to their sympathetic nervous system and the renin-angiotensin that is responsible for blood pressure regulation. So we definitely want to take that into account. There are also hormones, as I mentioned earlier. Obesity and diabetes is affected or can be caused by insufficient sleep. So hormones, ghrelin and leptin, they're responsible for the use of energy and regulating satiety, or the feeling of fullness. And those are produced during sleep. So when sleep is insufficient, the production of these hormones becomes very imbalanced. A decrease in the production of leptin lessens our body's ability to sense fullness. We're kind of tending towards overeating, decreased inhibition of poor food choices, and overproduction of ghrelin increases, which in turn leads us to an increased hunger. And this is encouraging overeating, leading to weight gain and eventual obesity if it continues. And decreased insulin sensitivity is noted in diabetes, and so those hormones, leptin and ghrelin, leptin is decreased in type 2 diabetes, it's noted that, and elevated in ghrelin is elevated. And so that encourages an increase of circulating blood glucose. The emotional effects of insufficient sleep are also noted in the emotional health. Studies are showing that individuals that are deprived of their sleep are actually responding to low stress situations. Say you just drop a book on the floor, or maybe break a cup or glass or something of that nature, and kind of blow that out of proportion. They're noticing that those individuals are responding to low stress situations in the same manner as individuals that are having proper sleep respond to high stress situations. Cognition is definitely affected by deficient sleep, as expressed in decreased work performance, memory, speed of thought, focus of thought, and mental acuity. So kind of bringing this all together, I definitely would be remiss if I did not provide you with some tools of application. As I said I would previously in the objectives, that you will have some tools available to kind of take inventory of your own sleep health and be able to use this as a gauge for yourself. So just please know these are just a good tools to apply on this journey of increased sleep health. I want you to be able to take inventory of yourself and just ask yourself the question. Get in the habit of saying, just kind of taking note of, how do I feel most days of the week when I wake up? Do you feel groggy? Are you waking up alert? Are you feeling like, man, I could just really use another 3 hours worth of sleep today? Kind of think about that. Then as you move along in your day, notice yourself. Am I having a problem focusing? Am I hearing and my memory being maintained? I know I've said it before myself. Oftentimes, I've got a lot on my mind. Just tell me again. Well, now you can kind of consider it that you may be decreasing a little memory if you're not having sufficient sleep. So I have to take note of that. Notice if you're staying awake throughout having difficulty. if you're driving and just so sleepy and you just need that caffeine, things of that nature to make it through the day. And so also noting if you are needing to take long extended naps and still trying to get yourself back in bed, something's going on. You may be getting the hours of sleep that's needed. However, they may not be sufficient in the quantity of rest. A lot of nighttime awakenings is an issue. You might consider if you have a medical condition. Symptoms such as restless leg syndrome could be indicative of additional health issues, poor circulation, things of that nature, diabetes, hot feet. And sometimes people have just difficulty. You can take note of it. Am I moving my legs about a lot in bed? Sometimes these things are things that actually become normal to you, but they're really abnormal. So you may notice if you have a sleep partner, you may ask your partner, do you notice me moving my feet around a lot in bed, my legs around? Is there an issue with obstructive sleep apnea? Are you snoring? Does your partner snore? Both of those things can be very impactful to both the person that is the snorer that's suffering with that, as well as their partner that is sleeping in bed with them. So it's definitely something along that. And is there any emotional issues going on? You'll want to look at, are you experiencing stress? Did you experience a stressful situation? Oftentimes what happens is that a stressful situation can come, a loss of a job, loss of a family member, or just definitely sometimes stressful times. We're all in stressful times right now with COVID-19 so well in our situation, and then maybe come months down the road where prayerfully this is all lifted, and however some of the impact of the detriment of deficit of sleep, the stressful situation is relieved. However, these sleep issues will remain. So where I mentioned, and also menopausal symptoms, a lot of women beginning to go through that time and phase. Are you noticing yourself being too hot at night? Are you having difficulty sleeping because of that? You really want to, as I mentioned, definitely any intrinsic factor must really be addressed, and you want to address that with your health professional in order to be able to remedy those and then move on to some of the extrinsic things that you can do in order to increase your sleep health. Also, being aware of what is insomnia. And insomnia is actually defined as having difficulty going to sleep or maintaining sleep in a restful state 3 times a week for 3 months consistently, and not being satisfied with the amount of sleep that you're receiving. So that is definitely something that you want to take note. And like I said, if it's not a intrinsic issue, a medical condition, then you will want to work with a psychotherapist, some cognitive therapy to be able to decrease some of those sleep behaviors. And so last but not least, as I mentioned earlier, just take note of how you're sleeping, but then also just a couple of tools regarding sleep hygiene. There's been noted that cooler temperatures in the home helps thermoregulate your body and produces a more restful sleep. Things like beginning to decrease your the electronic usage of in your home, turning off the television, not looking at your telephone, your laptop. Give yourself about an hour's break from some of that blue light and stimulation to kind of help increase the body's production of the natural hormone melatonin in order to work with your body and not against it in regards to beginning to have sleepiness in your body. Allow yourself 7 to 9 hours in the bed to sleep, and then taking notes, sometimes using a usefulness of a Fitbit or some kind of watch that is helpful in monitoring your sleep is helpful. And then also just refraining from large meals, spicy food, caffeine. Try not to take naps after 3 o'clock. And I will say this, if you are feeling tired and the opportunity presents itself, a good old 20-minute power nap can be very restorative and energizing to you. But if going over that 20-minute threshold kind of leads more into a deeper sleep and makes it a little bit more difficult to come out of it, thus making you a little bit more tired, and then also affecting and your ability to go back to sleep at the proper time at night.